Dr. Murray, you talk about something called the irrational approach to indigestion in your book.
Yes.
Could you explain that, please?
Well, yeah, in my book, I highlight just how irrational many medical approaches are. And if people really thought about how these drugs work and what they were trying to accomplish, they'd see that. And a good example of that is the way that we treat indigestion. How do we treat indigestion? Well, mainly we give drugs that block the digestive process, which doesn't make any sense at all. It's a classic example of using drugs as kind of like biochemical Band-Aids to relieve symptoms. And I think that's a path to bad medicine. And we know that these acid-blocking drugs, for example, they're fairly benign, but yet they're not. We know that the rate of gastrointestinal infections increases dramatically. They did a study in a hospital for pneumonia, bacterial pneumonia, and they found that there was a 4.5 times greater risk of developing bacterial pneumonia if a patient had been on one of these acid-blocking drugs.
Really?
So, you know, what they're doing is they're blocking a vital process in our body, which is the digestion of food. So by blocking that process, it leads to a whole long list of other potential side effects. And to me, that's irrational. Why not try and address the underlying cause? And in most cases, the underlying cause is a lack of digestive factors.
I know, that was very ironic.
It is, but you know, it's only ironic because the drug companies have done such a good job of their advertising. You know, you have symptoms of heartburn or indigestion. You take this product. You take this product to prevent those symptoms. You know, and what we should be doing is utilizing natural substances that promote the proper digestion and elimination of our food instead of substances that basically hinder that process.
What do you recommend for good digestion?
Well, it really depends on the issue. Many people lack the proper secretion of hydrochloric acid.
You indicated that in your book.
Yeah, I look at the nails. Our nails are largely composed of protein and minerals. We need hydrochloric acid in order to break down the protein, start the digestive process, and help to assimilate minerals. So if a person has weak peeling or cracked fingernails, that's a sign of lack of hydrochloric acid. Usually when people lack hydrochloric acid, when they eat food, they notice a bloating feeling or indigestion almost immediately. If that indigestion occurs maybe 30 to 45 minutes after eating a meal, that usually indicates a lack of pancreatic enzymes, so we can use digestive enzymes to help those people. And then there's conditions like the irritable bowel syndrome or gastroesophageal reflux disease, where we have clinically proven natural products to help relieve those symptoms.
Like peppermint oil, you suggest that?
Yeah, enteric-coated peppermint oil has great scientific research, and it's a wonderful product to helping improve the symptoms of the irritable bowel syndrome.
And those are rational approaches?
I think so. I think they're very rational.
Let's take the rational path to digestion, right?
Yes, exactly.
Thank you, Dr. Murray.
My pleasure.